New tonight, we are learning more about the state's efforts to increase vaccine equity. As of today, more than 455,000 people have received at least one dose of the vaccine. Our Way 31's Will Robinson Smith joins us live at the vaccine clinic at John Hunt Park. Will, what are state and local officials saying when it comes to getting the vaccine to a more diverse group of people?
Well, State Health Officer Dr. Scott Harris says they're not where they want to be when it comes to distributing the vaccine equitably, but he says they are taking steps to make sure that those who have been most severely impacted by the pandemic do have access to the vaccine.
It's a real concern, and I just want to tell my community, get the vaccine.
Kieta and Darby Parker got their first vaccine shots on Friday. They said it was a pleasant surprise for them to get the vaccine at this point.
Based off of, just how this past year has gone, and just how things seem to be very, unorganized, I really thought that it would be, a lot later.
But their jobs in education and manufacturing put them in this current eligibility slot. That's something that State Health Officer Dr. Scott Harris says was intentional, since Group 1B represents more racial diversity than Group 1A.
Part of the racial disparity we're seeing in our vaccination rates is because of who we've targeted in a way. If you start off with healthcare workers, in many cases people of color are just underrepresented in that group.
Even though only about 11% of the vaccine in Alabama has gone to black residents so far, the state is outpacing the known numbers in the country, which shows only about 6% of the national vaccinations have gone to African Americans.
African American community has suffered greatly in this pandemic. So we want to not only have higher uptake in the African American community, but build confidence related to the vaccine.
Speaking via Zoom with Way 31 on Friday, Dr. Carol Landers notes that there's still about 29% of vaccines in Alabama with no racial data. She says that information wasn't collected for other vaccines historically, but equity relies on having this data. Dr. Landers says there still may be a chance to fill in some of those gaps.
We should be able to capture this data on the second dose. But I think an equally important issue is to continue to build vaccine confidence within the African American community and other minority communities.
Back at John Hunt Park, the Parkers say they've received several calls and texts about how their shots went. They're hoping that others in the black community will follow their example.
Trust the doctors, trust the science, don't listen to your buddies. The math and science always works and wins out. I took a chance, I've got it, 15 minutes later, still here. Come get your shot.
And the focus of the mass vaccinations here at John Hunt Park this week was largely on getting people their first vaccination shot. And I spoke with one of the healthcare workers here as they were wrapping up today. She says they were able to administer 2,021 shots by day's end. Reporting live at John Hunt Park, Will Robinson Smith, Way 31 News.